is a brother and a child of God. Friends, welcome with me, Reverend Dr. Ricky Byaruhanga, an ENT specialist, a senior lecturer and the head of ENT Department School of Medicine in UCU. And he's going to be speaking to us on the topic, the ear, nose, throat health, what you ought to know. Rev, Doctor, you are very, very, very welcome. May God use you as you speak to his people. Over to you, Doc.
Amen. And thank you, my brother. I greet you all in the matchless name of our Lord and Savior, Jesus Christ. I am happy to be here. I thank you for inviting me. I will, just for the sake of starting, I'll put on a video for those of you to see my face. I am at home mercifully today. I managed to make it home in time. But as I'm speaking, please allow me to take off, and then I'll put on the video again when we are receiving the questions and answers. I hope it is okay, our leaders.
Yes, it is.
All right. Thank you. Thank you. All right, so let's get into this now. You have been ably team leader here. You have ably introduced me. By the grace of God, I love the Lord. I am born again, and the rest matter little, but that in my heart and life matters a lot. And by the grace of God, I thank God that I am able to share a teaching. Now, when I was approached and asked to share on the ear, nose, and throat, on this topic, ear, nose, and throat, Banange, I thought to myself, what do I share with people? You see, this discipline is studied in detail at master's level. And for 3 years, 3 full years, you study on the ear, the nose, and the throat. And so, my friends, our leaders here on online church found it fit to ask me to, to share what we studied in 3 years in 45 minutes. Can you imagine the challenge I have in my hand, friends? Anyway, as I meditated on this and thought through, I picked out I thought, what are 2 things that the Muntuawansi would want to know about this ENT, ear, nose, and throat? And then in going through this, some people inboxed me, and also when I shared with a group of people that we're going to talk about ENT issues, a reverend friend said, you must talk about this. And so hopefully when time allows, I'll drop in a third thing if the time allows us. But I would like to be able to share and have an interactive session so that you also share your thoughts and questions as we go along. And so I want to move on straight into the ear, nose, and throat. Now, a number of times I've had people come to me and say, Doctor, my eye is paining me and I was referred to you. And they are very disappointed when I tell them that, hey, sorry, I am not an eye specialist. I have ear, nose, ENT stands for ear, nose, and throat. Unfortunately, it does not include the eyes. There are people who study a full master's program on the eyes to study the ones we call ophthalmologists. ENT does not include also the mouth. Can you imagine? The mouth, even when we look through the mouth to see the throat, the mouth has been colonized by the dentists and the maxillofacial surgeons. Anyway, thinking through this, the ENT system, I thought about 2 things that I would want to share about this evening. And maybe when time allows, we drop in a third. When time allows, from people's questions and our questions, maybe we'll talk about other things. So the two things I thought about we should discuss this evening are earwax and snoring. Earwax and snoring. Now, I hope that I will not be too fast. The last time I was asked to share on Church Online, Online Church of Uganda, the feedback I got later was you were speaking too fast. I am hoping that today I will be a bit slower so that we keep up with one another. So let's talk about earwax. Now, um, on the market, in the supermarkets, some of the things on our shopping list, especially for the mothers, for the ladies, for our wives, are earbuds. And why do we buy earbuds? Because we want to clean our ears. What do we want to clean out of our ears? It is earwax. Now, I want to state it clearly this evening, friends, that earwax is normal. Earwax is normal and good for our ears. Unlike popular thought and teaching out there in our communities, earwax is not dirt. Sibujama, it's not dirt. Okay? The Bachiga Banyankole call it oburofa. No, earwax is not dirt. Now, earwax in the medical language is also called cerumen. Now, the skin on the hands, on the stomach, abdomen, on the legs has what we call sweat glands. And these sweat glands produce sweat. In the same way, the skin in the ear canal, if you look through your ear, that skin in there, before you see the eardrum or before you see the what, that skin has special glands called ceruminous glands. And these glands produce a secretion called cerumen. And that cerumen is the wax that we know. Now, there are two distinct genetically determined types of wax. If you're wondering, maybe you have looked into your child's ear or your friend's ear, and for some people, their wax is easily flowing, the wet type. And yet for others, they will tell you if they don't clean. And when I use the word clean, please note that I'm putting it in quotation marks. If they don't clean their ears, after a long time, they see dry pellets of wax, black or brown wax coming out of their ears. So genetically, there are people who have wet type of wax, and there are those who have dry type of wax. And the dry type may range from the solid dry and to some who have flakes. Especially if you look at Caucasians, Abazungu, some of them have like flakes, dry flakes of wax. So, what are the functions of this earwax? I will mention 4 quick ones quickly. One, this wax helps us to trap dirt and dust so that it does not reach that dirt and dust. The dust does not reach your eardrum. Very important. If you look inside the ear, if you ever have a chance to look in, the eardrum is a very thin membrane, very thin and yet fragile, and very important for us, especially for the sense of hearing. So we don't want this dust. And I mean, imagine our Kampala, where the villages where we walk, with all the dust flying around. Can you imagine the dust we breathe in? Can you imagine if it all accumulated in your ear? So the wax helps us to trap that dust and prevent it from getting to your eardrum. Number 2, wax has a special substance that protects against bacteria and fungal infections. In other words, it acts like an antiseptic. It kills some bacteria, not all, but some bacteria. In that way, it's protective to the skin of the ear canal and to the eardrum. Number 3, wax carries dead skin cells and other debris out of our ears. You know that sometimes when you're sleeping, insects can walk in, even when you're walking, actually. Insects can fly and get into tiny insects. But when they get into your ear canal, they will meet the earwax. And if it's there, then it will be trapped and with time can be brought out. Number 4, wax protects the delicate skin of the ear canal from getting irritated when water enters the canal, whether when you're swimming or when you are bathing. Now, if you ever, again, I'll mention this, not everyone will look into the ear to see, but if you look into the ear, deep in there, the skin is not black or, well, I'm talking black because I'm black anyway, but it's not dark outside, doesn't have a lot of melanin, it's pinkish white inside there. So it's fragile. And so this wax protects the layer, the skin layer, from the effects of water. Sometimes even this water has chlorine in it from the swimming pool. That wax will protect that ear canal. Now, why do we encourage people, or let me say discourage people from using earbuds, also called the Q-tips, also called the cotton buds? One, sometimes in trying, some people are very effective. They will do, a good job. They'll be very gentle with the earbud in the ear. But sometimes in trying to use this earbud, you push the wax deeper instead of getting it out. Now, when you push it deeper and it sits on your eardrum, then it will reduce the ability of the eardrum to vibrate. And when that happens, then your hearing reduces. And this is what brings people in hospital many times with earwax problems. I was trying to clean my ear, they will say, and then suddenly I could not hear anymore. I felt my hearing had reduced. The earbuds can do that. Number 2, even when you are gentle and careful, as you use these earbuds, they irritate the constant, especially for people who use the earbuds a lot. You cause damage to the skin of the outer ear canal, and that will lead to wounds and infections. And my friends, let me tell you, if you have ever gotten an outer ear infection where you have like a pimple in the ear, oh my, people can swear that they have never experienced such pain that they get when they have pimples in the ear. It can be quite excruciating. Finally, even before that, sometimes these earbuds you'll do a thorough job, remove all the wax, and in that way you say my ears are very clean. But what you have inadvertently done is you have left your ear canal skin unprotected, because you have cleaned out all the wax and therefore cleaned out all its protection. And then the other one, that comes to my head, at my mind now, is what I've seen once in a while. You see, children learn a lot from adults, and they usually learn from what they see you do. Please remember, parents, that you are these children's heroes. They are these young chaps. And so when they see you with these earbuds, cleaning your ears and cleaning their ears, they learn, and they know that's a good thing. I have seen nasty accidents, patients coming in with nasty accidents. A child saw and learned that earbuds were good. Daddy and mommy were using it in our ears. They get those earbuds, a 4-5-year-old, and does the same to a younger baby. They get this earbud and they try to do what daddy and mommy were doing by cleaning the younger baby. And they don't know how deep they should go. And I have seen perforated eardrums coming in because of this. I've seen people who were trying to apply earbuds and someone came and knocked their hands accidentally, and they push the Q-tip, the earbud, deeper inside, and they perforate the eardrum. Do you know what that means when your eardrum is perforated? If it does not heal on its own, number 1, your hearing is reduced. You have caused long-term problems, this person. But also, if we have to repair this eardrum, what we call tympanoplasty, you have to prepare yourself to part with, on average, between 3 and 4 million Ugandan shillings in an average hospital here in Kampala to repair your eardrum. I hope that can discourage you enough to keep away from earbuds. Anyway, so what happens when we have a lot of earwax in our ears? I have a small a picture there. I hope that will be, it should be able to, that's a picture of the ear cut into half. We see the pinna. Unfortunately, I don't have a cursor to move, but you will see the pinna, the ear, the outside, the one that's like the wing, then the ear canal, which leads us to the eardrum. Now that brownish thing is the wax. So when the wax accumulates in there, it blocks sound from getting to your eardrum. Remember, how are we able to hear? The outer part of the ear, the one that's like a wing, collects sound. The sound waves are collected and concentrated into the ear canal. The ear canal leads these sound waves to the eardrum. The eardrum vibrates and transfers this energy into mechanical energy through the oscars. There are some small bones there, then later into the inner ear, and then to the nerve, and then you're able to appreciate sound. So when this ear canal is blocked by wax, then it means that there is reduced entry of sound onto your eardrum, and that affects your hearing. So next slide, please. What happens when you have a lot of earwax? I mean, how does it happen? Sorry, how does it happen? One, some people naturally produce a lot of earwax. And an example that I'll share, a similar example is sweating. There are people who sweat, just generally sweat a lot. And you can't say they're abnormal unless if they have a fever, of course. If they don't have a high temperature and they just naturally sweat a lot, they are there. And so in the same way, there are people who produce a lot of earwax, and that may grow and accumulate quickly and block your ear canal. Secondly, there are some people who produce naturally hard or dry earwax. Remember, we said that genetically, some people produce hard wax, others produce wet wax. Now, the ones that produce hard wax, there's a tendency for this wax to accumulate in the ear canal and not flow out easily. And therefore, when it accumulates, then to block your hearing. Thirdly, there are people who have narrow ear canals, such that the wax does not easily come out. Or they have a lot of hair. I mean, we all have hair in our ear canals, but there are people who have a lot more. This hair may hinder the progress, the movement of the wax out of the ear canal. And then also, we know that prolonged stress can create extra earwax production due to the increased levels of cortisol. Cortisol is the stress hormone. So for people who are generally living a very, very stressful life, there's a small possibility that because of your high levels of cortisol in the blood, you may produce a lot more wax than usual. And then finally, if you have ear canal injuries, whether you're because of use of earbuds, you have an infection in the ear canal. There are people, it's interesting what people put in their ears when the ears are itching, especially for people who have their tendency for allergies. There are people who will put every sort of thing in the ear: pens, pencils, sticks, car keys, and all those things. And sometimes those can injure the the skin of the ear canal, and therefore cause increased accumulation of production of wax. Now, how would you know? How would you know? Next slide, please. How would you know that you have a lot of earwax? One, so the symptoms therefore are: one, you have reduced hearing, or what we would call hearing loss. Two, you have ear irritation, as if it's itching you, as if you have a fullness in there. Three, you have what we call tinnitus. Tinnitus, the other name for it is abnormal noise, really. Other meaning, abnormal noise in the ear, like a buzzing noise in the ear. And sometimes for people who have a lot of earwax accumulating in there and blocking their ear, they feel a sensation of numbness on the affected side, as if that side is paralyzed. That side is not actually not paralyzed, but they feel a bit of numbness. The other challenge, of course, with earwax is that if you come in, for example, in the clinic, you have ear pain, maybe you have an eardrum infection, a middle ear infection. If you have a lot of earwax in there, even when we're looking with our torches with the otoscope, we may be unable to see the state of your eardrum, and that can be a disadvantage because then we're not able to make a very good diagnosis of what's happening. So, how do we clean our ears, friends? Therein is a problem. Whenever I mention the word clean, please put it in quotation marks, because some people may take that as their take home. So the doctor has said we can clean our ears. Our ears are self-cleaning. I repeat, our ears are self-cleaning. Please note that naturally. So remember, wax has been placed in the ear. God is wonderful in his ways. He put protective mechanisms. He knew that you would not protect your ear deep in there, your eardrum well enough. So he put that mechanism of wax. So wax is a good solution. For those of you who started with us, remember we said it's protective, takes out dust, it's antiseptic, it kills bacteria. But as this wax grows old, it will start moving, it pushes outwards. So actually, if you see people who have not cleaned, and put that in quotation marks, who have not cleaned their ears in months, you begin to see wax coming outwards, flowing outwards, out of, and of course, someone will say and say, your ears are not clean. Why? Because they're seeing wax is flowing outwards. But that's the natural way. So, friends, if you must clean your ear, get a wet cloth or your towel after you have bathed, put it on your finger and use that finger to clean outside, just outside where the ear canal starts from. Do not put anything beyond where your finger reaches. Your finger, not earbuds. Please keep away from earbuds. Now, generally, we have noted that as people age, there are changes in the glands, just like our body, it wears out, where it gets a bit of wear and tear. So there are changes in the glands inside the ear canal that cause the earwax produced to be drier. And when it's drier, then it solidifies in there. And there's a tendency for the elderly, 60, 70 years, 80 years, to face challenges with earwax accumulation. Now, if you find yourself in a situation where your earwax has become too much, what would you do? One, there are simple measures at home. You can get oil, cooking oil. Now, when I mention this in hospitals, people sometimes look at me as if I'm, with a weird look, Cooking oil. You can get olive oil. Just put a few drops in that particular ear, maybe 2 or 3 drops. You do it once a day for about a week. It will soften the wax. The wax will come out. If you want to use sophisticated things like medical things, get an eardrop called Serumo. They go by different names. There's Serumo, there's sodium bicarbonate, there's D-wax, any of those things. You put it in the ear, those 2 drops, maybe once or twice a day for about a week. It softens it and to flow out. If it fails to flow out and still blocked, come to a doctor. Come to a doctor and they will syringe it out. And nowadays, with our medical training, even a medical officer, not necessarily an ENT specialist like me, even a medical officer is trained enough to be able to wash your ears and clean out the earwax. Now, friends, because of time, allow me to quickly run away from that topic of earwax. I know I might have generated some questions, but we'll take them as we are towards the end. Let me quickly run to the issue that sometimes disturbs people. Have you ever been somewhere? Maybe you have visited. Maybe you have a function and someone sleeps in the night and you hear all manner of noises emanating from people's throats and noses. It's like some are like tractors, some are like different. Imagine different vehicles passing through your neighborhood. And what's happening? Someone has slept off and they are snoring. Now, what is snoring? Snoring happens when air is prevented from flowing freely through the nose and throat due to physical obstruction. And this, when air goes through your nose forcefully because the airspace has been narrowed, or in the throat, the airspace has been narrowed by enlarged tissues, then when it goes through forcefully, it causes the tissues to vibrate. And that vibration is what we call the snoring sound. Okay? Now, snoring can be caused by different things, and the causes differ from person to person, depending on their anatomy and their lifestyle. So, I will quickly run into the causes of snoring. One, top on the list, is overweight. Whether overweight, obese, or overweight per se. Now, what happens when someone gains weight quickly? When someone gains weight quickly, it is distributed uniformly. So even the tissues in the throat will have some fat deposited there. And this excess fat and fatty tissue can cause you to snore because it increases pressure or narrows your throat, especially when you're lying down. Sometimes people will snore because their nose is blocked, their sinuses. Now, what are sinuses? A number of times I see people coming into hospital and they say, Doctor, I have sinuses. And sometimes when I'm in a joking mood, I will tell them, oh, I also have sinuses. What do you mean? Now, I know that generally when people talk about sinuses, they are talking about allergies, okay? But just suffice to say that in our skull bone, we have air spaces there. And these air spaces are what we call sinuses. We have sinuses above the head, the forehead, between the eyes, below the eyes, what we call the cheek sinuses, the maxillary sinuses, and behind the eyes. What the Baganda call a chiwanga. The Bachiga Banyankole Banyachitara call them a bisheshenku. Those are the sinuses. So sometimes when the sinuses are blocked because of disease, because of sinus infections, when you have flu, the common colds, the airway becomes narrowed, air passes through forcefully, and you're forced to snore when you're sleeping. Now, when you look at the structure of the nose, the middle part of the nose that separates the right and the left nasal cavity, or the right and left nostrils, is called a septum, the nasal septum. If for any reason that septum is bent to one side, maybe because you had a fracture, something hit you and the nose was bent inside, if you have a deviated nasal septum, it reduces air entry on one side, it will cause snoring. Allergies. And this allergies is such a big topic. I'll not go into the details now, but when someone has allergies, it basically means that their body is reacting to certain things in the environment. So when you have allergies, they could actually reduce your nasal cavity space and cause snoring. Pregnancy. The physical and hormonal changes which occur during pregnancy can increase the likelihood for snoring. The sleeping position. For some people, when you sleep on your back, you are highly likely to snore, as opposed to when you sleep on your side or when you lie on your belly. Certain medications are known to relax our muscles, and these, an example, are antidepressants or sleeping pills. And when they relax our muscles, they can snore. Smoking, that smoke causes irritation in your nasal cavity and therefore causes inflammation, which causes swollenness inside your nose, reduces the air space, can potentially cause snoring. Alcohol consumption, we know that, people who take alcohol, the muscles will generally relax. That can increase the chances of snoring. Genetics. Snoring is not inherited, that's for sure. I know that back in our homes, in our villages, when they hear a child snoring, they say, oh, yeah, fulutanga jajawe, but snoring is not inherited. However, there are certain anatomical features that are inherited. If someone has a short jaw, you may inherit that from your parents, from your dad or mom. And when that happens, then you might actually have snoring like your parent or your jaja. Enlarged tonsils and adenoids in children. Now, again, that's a big topic to talk about, but generally speaking, when you open the mouth and look at the back of your tongue on the side, there are swellings that are called tonsils. Then the adenoids are at the back of the nose. Now, if these are enlarged because of certain disease processes, you can actually have snoring. So, how do I know that I'm snoring? How would you know? For example, if you sleep alone, it's hard to know. But I'll tell you some things to look out for. If you sleep alone, or if someone tells you, you are snoring, if you want to be sure, you can record yourself. Nowadays, our phones have facilities to record. You can leave on a recorder and go to sleep, and put in an alarm 2-3 hours later, wake up and switch off the alarm and listen to your sleep that you recorded. But anyway, if you don't want to do that, there are certain simple signs that show you that you're snoring. One, if you wake up with a dry mouth, generally you wake up every day and you have a dry mouth, it means that your nose, which is supposed to be helping you to breathe, was fairly blocked and you are forced to breathe through the mouth and the mouth dried up. There's a high possibility that you snore. If you wake up with a sore throat, if you wake up frequently in the night, many times in the night, struggling for air, if you wake up many times to urinate, now of course, you take all these, you don't take one point and say, because of this, I am snoring. No. For example, the elderly patients, elderly men in their 60s and 70s, we know that our prostate can enlarge. When it does, then you have a bit of frequency in urination. But generally for a young person, a young lady, a young gentleman, if you wake up very many times to urinate, you might want to find out if you're snoring. If you're having restless sleep, if you're waking up in the morning with a headache or feeling tired generally, in spite of sleeping many hours, then you might be snoring. Now, friends, is snoring bad? Now, not all snoring is necessarily bad. Of course, if you have a partner, if you have sleeping with people in the room, snoring may not affect you, the snorer, but may affect the people who are listening to you. They may not have good sleep. But generally speaking, when is snoring a bad problem for you as an individual? When you begin to struggle with air when you're sleeping, and you struggle and wake up, or the people who hear you snoring realize that you breathe, you snore, and then stop breathing for a few seconds, and then just generally wake up or keep tossing and turning in bed. That's a problem. We call that obstructive sleep apnea. And that is a danger, because it means that those times when you stop breathing, when there's cessation of breathing, it means that your oxygen is cut off from your lungs. And that is not a good thing. Because when that happens, of course, you snore, you wake up choking and gasping for air. It is not good for you. It's not good for your health. Now, how would you know? How would you know, friends, that you might be having symptoms of obstructive sleep apnea? One, you find that in your sleep you wake up gasping or choking during sleep. You have poor concentration during the day because your brain did not rest. You have memory loss, lack of interest for the marriage, lack of interest in sex, loud snoring, morning headaches, anxiety or depression, daytime sleepiness. For some, you have high blood pressure unexplained, frequent urination. I mentioned it earlier on for snoring, people who grind their teeth when sleeping. All these might be pointers of obstructive sleep apnea. Now, why do we worry about obstructive sleep apnea? Studies have shown, friends, that untreated sleep apnea can significantly reduce your life expectancy, with findings showing that individuals with moderate sleep apnea have increased risk of death in their sleep by 17%. And this is roughly doubled when you have severe obstructive sleep apnea. We know medically that when you have those episodes of stopping to breathe and the chest is trying to draw in and pull in air against the closed upper airway, if this continues for months and years, you are exposed to getting pulmonary hypertension, increased pressure in the lungs, because you are trying to pull in air and it's not coming. When that continues on for years, there is a risk of getting right heart failure. It's also called copulmonale. Copulmonale. Now, again, this is a big topic. I don't have enough time to go into it. But if you find that you have some of these symptoms, you need to go and look and see your physician. You may need help. See your doctor. You may need help. Now, how do we treat obstructive sleep apnea? Treat the cause. Treat and manage the cause. As simple as that. If it is overweight, go on a diet program, go and do something that will help you to reduce your weight. If it is alcohol, stop taking the alcohol. If it is the antidepressants, they may work on the doses or adjust on some of the drugs. If it is a nasal problem and you have a deviated nasal septum, go see your doctor and they sort out that nasal septum. If you have allergies, treat the allergies. In other words, deal with the cause of the obstructive sleep apnea. Okay, friends, now I really need to leave some few minutes for questions and answers. And if I have a bit of time, maybe 2-3 minutes later on, I will talk about halitosis. Have you ever been with someone, talking to someone, and you turn your nose away because their breath is smelly? The married people. A friend of mine who sent me asked this request, said, talk to us, because some, not all, but some married people are struggling when a spouse has a bad breath. In spite of brushing their teeth, their mouth is smelling, the breath from the mouth is smelling. Now, quickly look out for issues with your teeth, issues with your tonsils, the tonsil stones. Do you have sinus problems, chronic sinus problems? The Baganda call it echibobe. Echibobe. Okay? Do you have a lot of flatulence, belching a lot? You could be having bad gas coming from your stomach. But anyway, I don't have time to go into all of this, but let's receive some questions and comments. So let me end here for now. I want to thank you for listening to me. I might have been very fast, but my apologies. These were huge topics to put in just 40 minutes or so. Thank you for listening, friends. Back to
Dr.
you,
Ricky, thank
moderator.
you. Thank you so much, Dr. Ricky. Can you hear me?
Yes, I can hear you, sir.
Oh, thank you so much. That was a library of knowledge and wisdom. Thank you so much. On the when you say we're talking about cleaning the ears, sometimes there's some people who see themselves with clean ears and feel, yeah, it is good to keep your ears clean, and they are that clean because they clean them all the time. From your talk today, we are realizing that is a danger, because then you have removed the protective cover from within the ears, and it's also dangerous. And then you have said the ears are self-cleaning. Then you touched on the on you touched on the um, on the breath, for the breath that comes out of people. It could be pointing to something. You touched on snoring, which is a problem that many people are facing, and you told us what that could mean for different people. So thank you so much. I think at this time I would like to open it up for questions. I am just trying to check in the chat. Uncle Bob, at some point I'm going to invite you to come in, but I'm just trying to check in on the chat just to see if there are any questions. I'll just check the chat. Do earphones spoil our ears? Does it affect our hearing system? Somebody has asked that. There are thank yous coming in. Doctor, too much wax. Says, hey, sorry, the questions are coming in. Doctor, do earphones spoil our ears? Do too much earwax in the ears make our ears itchy? How do you handle such without cleaning the too much earwax? And then more thank yous there. Thank you, doctor. You help us go through how to go about someone with impacted earwax at the same time with otitis media. Maybe doctor, first begin with those ones as I look through other questions.
All right. Thank you. And thank you, listeners, for listening in and for the appreciations. I am grateful. Thank you for allowing me to share some knowledge. Now, quickly into the questions. Do earphones affect our ears? Yes and no. The yes and the no bit is that when you use them, you use earphones well, they shouldn't affect your ears. And what is good use of earphones? Number one, there are different qualities of earphones. There are those that are very hard, and you push them deep into the ear canal. When you do, sometimes remember we said the earwax will come out freely on its own, naturally. Now, when you put in these earphones and push them deep, they will push the wax backwards into the inner side of the ear canal, and that to a small extent can cause impaction of earwax. Number two about earphones is that the quality. Some of these are rough on the skin. If they're not rubbery, they are rough on the skin, and so they will tear the skin, and potentially they can cause ear infections, ear wounds, which can get infected. And finally, have you ever been, especially around the Gen Zs, and they are putting on earphones and you can hear what they are listening to? If you sit next to someone and they have earphones on and you can hear what they are listening to, the noise, that the decibels are too high, and they will damage that person's ear, their hearing. And unfortunately, that loud sound damages the inner hair cells of the nerve, and the effect comes 10 to 15 years later. When they have even gotten out of that effect, they no longer want to use the earbuds. But unfortunately, the hearing problems will begin 10 to 15 years later. So avoid, if you can, loud noise using the earphones. Quickly, itching, does earwax cause too much wax cause itching? Yes, for some people it can. How would you handle it? I mentioned the simple things at home. Get olive oil, get our usual cooking oil. Don't even cook it, boil it. Just put some drops in the ear. If you're not sure about it, get the chemical things that we have in pharmacies. There's an ear drop called Cerumo. It's an oil, really. There's another one called D-Wax. If you don't want to use those, you can use boric acid. These are things that you can use to soften the wax, or sodium bicarbonate, to soften the wax so that it comes out of your ear. Okay. What do you do if you have earwax and you have otitis externa, otitis media? This otitis media is infection of the middle ear. Otitis externa is infection of the outer ear. Now, both of these can cause pain. So trying to remove wax when you have a coexisting infection can be very, very painful. My advice is treat the infection, put eardrops in the ear to soften the wax so that you allow the earwax to come out on its own. If it doesn't, after the infection has healed, then you can syringe the ears, maybe a week or two later, to wash out the wax. Thank you.
Uncle Bob, if you're there, please kindly help me. Okay, Doctor, thank you. Thank you so much. I would like to invite Reverend Benjamin to close us off with a prayer and a blessing.
Thank you so much, our brother. Doctor, there are a few questions before we can call it a night in the chat.
Yes.
I request you to first respond to them and then we pray. The first one says, I believe, what causes someone to tell you that he or she is hearing noise when you can't hear anything or see anything making noise? Secondly,
we go. Hello?
Lots of sepsis are happening secondary to tonsillectomy done in village setups. What is your take on how to go about tonsillitis? Another question said, yes, how about salivating thick saliva every now and then and you are not pregnant? How can how can one know by self-test whether he or she has bad mouth odor? You can keep checking that as you respond.
Let me quickly answer some of these. Yeah, in the next few minutes. Tonsillitis. So tonsillitis is an infection of the tonsils. The tonsils I mentioned were those swellings beside your tongue at the back in there. The tonsils are very helpful to us. They are lymphoid tissues. They help us to trap bacteria in what we eat, what we drink, what we breathe in. They are good for us. But sometimes they can get sick. And when they get sick, that's what we call a tonsillitis. And when that happens, you'll have a sore throat, you have pain on swallowing, fevers, and they are red when you look at them. That should be treated with antibiotics. In the villages, there are people who put with a long fingernail, they will scratch them so that they bleed. We totally discourage that because some of those can cause tonsillar abscesses. We totally discourage and even cause more infection with those dirty fingers. What causes someone to hear noise when others are not hearing? Now, abnormal noise is in the ear is called tinnitus. Sometimes this can happen when, as I mentioned earlier, if you have a lot of earwax which has accumulated, you will hear abnormal noise, buzzing noises in the ears. If you've been listening to very loud sound and or your ears are impacted by a very loud sound from a loudspeaker, you can get the high-pitched ringing noises like we used to get when you would get quinine. So yes, some drugs can cause high-pitched noises and loud sound. Other people may not hear it, but if your hair cells, eardrum, and the nerve have been affected, then you will hear those noises. Now, growing up, my grandma told me, I feel my ear is paining, I put clean water. Oh, keep away. Those are theories in the village. Bambi. If your ear is paining and there is an infection, seek medical advice. Let it be sorted out. We are not sure what kind of, when you put it in the water, what you will do inside there. It may even cause more blockage. What about salivating, having thick saliva when you're not pregnant? Now, generally speaking, saliva is very good for us in the mouth. It keeps the mouth lubricated, but very important also, it has enzymes in it that help us to digest some food. Number 3, saliva has some substances that help us to kill some bacteria. Now, saliva is produced when you have fluid and enough water in your body. When you see people who are getting thick saliva, it means they are not generally not drinking enough water. You are not well hydrated. And that's if you're not sick. If your glands are not sick, they're not paining, but you have thick saliva, check the amount of water you are drinking. Does too much coldness affect our ears? To a small extent, especially for people who have allergies. If your nose gets blocked, your ears can get, because of the coldness, can get itching. If you have allergies, yes, too much coldness can affect our ears for some people. How about people who cut elongated uvula? This is common, I think, in the East, amongst the Somalis, amongst the Eritreans. We discourage it. The theory is that a long uvula causes throat infections. So when someone gets recurrent throat infections, they cut out the uvula. The uvula is that, the Baganda call it a camilo, you know, that thing that comes off the palate, and that dangles into your mouth. The Bachiga Banyankore call it a kashondaburo. That thing is, leave it alone. It's not the cause of your recurrent infections. If you have throat infections that are recurrent, come to your doctor and ask about it. They will help you. How would you self-test that you have a bad mouth breath? I think I will end with this. That now, if you don't know that you have a bad breath from your mouth, 2 things. 1, sometimes you just see people turn away when you talk to them. But realistically speaking, put your hand, your palm, before your mouth and breathe through it. Breathe through it. You will smell that smell that comes out, the breath that comes out and gets to your palms. You will smell it and be able to tell that you have a bad breath. I think let me end here in terms of time. Thank you, friends, for listening.
Thank you, Dr. Reverend Ricky. Been wonderful. One more question.
Yes.
For swimmers, and also it happens when you're taking a shower, when water escapes into your ear and you feel it is bothering, you can't stand, you can't sit, you can't do anything. What is the best way of getting it out?
So when water enters, generally speaking, whenever we are bathing, somehow water has to enter our ears. That's for sure. Even when you're swimming, water has to enter your ear. The problem comes in when you already have wax which has fairly accumulated, not blocked you, but it's a lot. When the water enters the ear and finds this wax, the wax expands a bit, and then the combination of the water and the wax block your ear further. The simple thing you can do is just bend backwards on the side to let the affected ear face down. And if you give it like 10 minutes, generally speaking, that water and wax will flow out. Actually, when the water flows out, it's kind of warmish, okay? If that fails, put some oil in the ear and give it a day or 2. If it fails, come to the doctor. Go to your doctor, your medical officer, your specialist. They'll be able to wash it out.
Thank you, Reverend. Dr. That has been a buffet 7 course. Thank you very much. It's been wonderful. Dr. Noah Hindehoro Bainuka, you'll allow me to call someone to give us a vote of thanks, and then we shall close it. I will request the host to make